10 to 15%. So another reason not to drink if you're on some of these medications.
Yeah, I think I'd like to add to that I guess it's a kind of a myth that people think that our food in our stomach is actually digested because of the acid. The acid does play an extremely small part in digestion, and you can knock out most of it and digest completely normal. There's a far greater role for digestive enzymes that are secreted from the stomach and breaking down
As a matter
the
of
food.
fact, when the contents of the stomach leave the stomach normally, one of the roles of the pancreas is to put bicarbonate into the beginning of the small intestine to neutralize the acid, because many things cannot be digested in the presence of an acid environment.
Dr. Proscia, is the patient asleep during endoscopy?
Generally we use what's called conscious sedation. I like to prefer to call it unconscious sedation. We give medications that don't require you to be intubated or machines to breathe for you. They can be titrated. The dosages of these medications can be titrated. Invariably, my patients don't remember the procedure. There are some patients we have to use more intensive medications to put them out. Patients that may be on other medications that will make them resistant to the medicines we give for conscious sedation. But our goal in doing endoscopy is not to make the patient uncomfortable. Our goal in doing endoscopy is to just get the diagnostic test or the therapeutic test done. My favorite case is one that the patient asked me when I'm going to start after I finished. And that's usually the case.
I agree. That's always fun. Dr. Proscia, what causes food to get caught below the breastbone? And what is the best treatment after being on Prevacid for 6 months to a year? I still have this problem.
Okay, that's the symptom we call dysphagia. Dysphagia, the food getting stuck. Dysphagia can be a mechanical problem or it can be a functional problem. If it's a mechanical problem, it can be from a stricture of the esophagus, from burning and repairing, and the esophagus closing down. It can be from a problem called an esophageal ring or a Schatzki's ring, which is an ingrowth of the lining of the esophagus, usually at the level where it meets the stomach or it meets the hiatal hernia sac. That's an acquired problem that may not be related to reflux disease. Both of these problems can be fixed through an endoscope. You can stretch the esophagus and alleviate the dysphagia, the sticking with a stricture, and you could fracture or break rings and open that up. This symptom can be from a tumor. That's why we take it seriously. If a tumor grows in your esophagus, it can close the opening or the lumen of the esophagus slowly and cause a sense of the food getting stuck. Another mechanical problem. Diverticula, or pouches that can form in the esophagus, also can cause a similar symptom. Functional problems. The muscle doesn't work right in the esophagus. It may not work at all, or it may work too well. There's actually a problem called achalasia, where the lower esophageal sphincter does not relax. It stays tight. It's almost the antithesis of what we're discussing this evening. And by not relaxing, the esophagus is not able to push the food through. That can occur at the lower sphincter, and it can occur also at the upper esophageal sphincter. There's a variety of other muscle disorders within the esophagus itself that can cause this problem. We have nutcracker esophagus, corkscrew esophagus, all these muscle disorders. They're very well evaluated through the manometry tests that we discussed.
David, I think this one is more up your alley, perhaps. Can a defective vagus nerve be the cause of reflux?
That's an interesting question about a defective vagus nerve. If a vagus nerve's been cut in patients that have had a vagectomy that we do commonly for ulcer disease, I'm not aware of anybody that has a lot of reflux from that. Now, saying that, in actual fact, the vagus nerve, what that does is it stimulates the stomach to contract and the exit to the stomach to relax. And so if you cut the vagus nerve, if it's not functioning, then I think that you probably would not have an increase in reflux unless the exit to the stomach isn't working very well, which means that your stomach won't contract and it gets bigger and bigger and bigger, and it's just it's a kind of like a mechanical problem that you fill the bag up and it's not emptying and it's going to come out the top. I don't know what you mean by defective vagus nerve, but that's would be what I would think it is.
Okay, one last question before we have to end, and this is sort of a combination, a similar question. This first question, and I guess this is for Vito, Is there a new pill similar to Propulsid to help the sphincter muscle close properly? And in a similar fashion, someone writes, any long-term ramifications in using Reglan to control my GERD?
You notice I avoided that topic. And I actually erased that from my step-up therapy. One of the class of medications we used to use for reflux management